they're opening.
Yeah, so it's like no one, there is no COVID then. I know. When people are like right next to each other, you know.
So bizarre.
I went to the restaurant last weekend. There we are, yeah. I went to the restaurant last weekend and there's a table right there with 5 people with no mask right here.
Did you have to wear your mask while eating?
No, they don't make you wear a mask.
Like, okay.
It doesn't make sense.
They're working.
Yeah, it says, oh, there we go.
Is Wi-Fi
Now
on?
we're live.
On both?
Mm-hmm.
Hey guys, it's Dr. Emer, and luckily we're back in the office. You know, LA is opening this weekend, so I don't know what's going to happen with masks, but right now we are staying COVID covered, and we have our beautiful patient here who's doing her yearly sort of touch-up. She doesn't really need that much, but we do 2 main places to just make her features pop. One is her cute nose. We always, actually it's maintained a lot. We actually brought the tip up past 2 years, I feel like, right? The past 2 or 3 years, and it's pretty much maintained. So we'll do a little bit on the bridge and to the tip just to keep it up. And then she already has really strong features like a high cheekbone, defined jawline. So we make the central part of her face pop with a little lip filler. So we're gonna use VOLLURE, and I like this because this typically lasts a year or longer, which is probably why we don't need to do it that often. But it's great because it's super soft looking. So in general, I don't want to overdo how she looks. So I'm just going to do a small amount. The thing about this filler is it's very fast flow. That's what we call. So what that means is you have to really understand how to press in the filler as you do it, because otherwise the chance of it kind of moving around after injection is kind of high. So, but if you do these really small aliquots, little baby threads. Now, there's a huge trend right now for people to do this keyhole pout, or what some people call the cleavage technique, where they put a little toothpick or floss in the middle of the lip and make a line there. I only would do that in somebody who has like a lip with that shape. You don't want to, I think it makes it look overdone. So we're trying to keep it where like nobody knows she had anything done. So we're doing little pillars to just get the center part look a little more cute. And that's it, nothing crazy. They ask me anything?
Yes, they asked. This is VOLLURE.
Yes, this is Juverderm VOLLURE. It's one of the longer lasting of the Vicross technology fillers. That's just a special type of cross-linking that makes the filler last longer. Now, just so you guys know, if you do a little research, these fillers are the only ones that have been shown to have long-term issues if you use a lot of it. So you want to use little bits. As long as you use a little bit, you're totally fine. That's why we only do a small amount. So lower part already looks great. And the cool thing about VOLLURE, you guys, is it actually starts to change a little bit minutes after it's injected. So I like to just sit there a little bit and watch it and see how it looks, because it really does make a difference. It changes a little bit, softens in. Now the other cute thing is she has a really cute Cupid's bow, and that's what gives a lot of definition to females. So we're going to define, this one's a little pinchy, we're going to define a little bit more in the Cupid's bow by defining the pillars here. Okay, so we're going to go right up into the pillar area, just very small.
They're saying hi from Brazil.
From Brazil, I love my Brazilians. Hi. So we're gonna do, again, just a little, nothing crazy. Good. And then again, for her, I really just want that center part to be a little more defined. And we can do a pillar technique where we try and get this to lift up a little bit more at the edge, but we don't want hers to look too overdone. So we'll do a small amount. To give her a little bit of volume there. That side's done. We'll take a look. Alright, so wipe me off. It's hot in front of the lights. And then same thing on here, little pinch, and good, almost done.
They're asking
Hold on
why
a second.
sometimes it bleeds more than other times.
Frank bad luck, you guys. Sometimes it bleeds more than others. The lip tends to be very vascular. Its main blood vessels, all from the central part of the face, come like this. And they go like that, and then they branch over into here in the labial arteries. So, you know, in the old days when I used to do a lot of skin cancer treatments, the lips were a big area for us to have to do a lot of protection for bleeding. And bruising, same thing. When you're doing lip injections, you just have to be careful. Going nice and slow helps because there's numbing medicine inside. Now, one of the things that it is good to do as this sits for a little bit, right here on the lip corner, it's always good to place just a small amount because that helps kind of support the lip itself and give the corner of the lip a little upturn, not much. And then the other thing is right at the edge of the fold, 1, 2, 3, sorry, it's a little sensitive. Also a little bit right here, because this area here holds this lip up. And so even threads in this area will hold the lip up. So, take a look in a second. I'm just gonna grab a little alcohol. I'll go to the opposite side. Cool. It's white, looks really good. I just want everyone to see it when it's a little shiny, you can usually tell. So again, we're just gonna do a little support right at the corner, very little. Nothing crazy because she's younger. When you get a little older, you might need a little more here. And again, one little pinch on the fold. And then I wanna go with the other side for a second because, sorry, I keep moving. Because this area here, I wanna get a little more elevation.
How long do these fillers last?
Well, we said the Vicross, thank you, go 1 to 2 years, typically. But every other one's different. On average, the hyaluronics are gonna go 6 to 12 months on average. But this one will be about a year or more, and she didn't do her lips for a year. I think we've done other ones too. We've done, I think, silk before. I can't remember. But it's a little softer, and she wouldn't get as much sort of shaping with that. I'll do one more pinch on your fold here. Just a little bit. Okay, so now we'll show her. Yeah, just want to wipe her off and then hold on. We're going to do a little reveal. Hold on. I'm also going to just do, you can see it a little bit better when it's a little more shiny. Right now it's going to feel a little tight, okay, because you do all those injections. But now go ahead and take a look. Go ahead and show her. We'll do a little Emer reveal. What do you think?
I love it.
Now you have volume. So close for a sec so that you can see. We created a little bit more shaping on the Cupid's bow, 2/3 bigger volume in the bottom to the top, and then some definition throughout. We don't want to extend her lip too wide, you guys, because her mouth is a little bit closer together, so you don't want to extend her face. We kept her natural shape so that it blends well, so turn from every angle. What do you think?
Oh, I love it. I actually have a little upper lip now.
Yeah, we didn't have, well, that's the other thing too. If you look from the side, let me show you here. It doesn't look like this is protruding. And a lot of people are overdoing fillers up here to get the lip to come up, but then it protrudes forward. With her, I like to keep more of a natural look, so if you kind of go 360 and you go like this, you can see it doesn't look like a fish mouth or anything, right? It just looks natural. So, perfect natural lips. Now we're gonna go to the nose. Stay tuned. Cool, and then you should just ice. Let's grab a little ice and we'll switch. That looks good, right?
It looks awesome.
Let me see if we can